Claude. If you put it together with my family name, you know that's the weakest linguistic link in this room. So thank you very much for inviting me first, and then thank you very much for your attention. Today I'm very happy to be here with you in order to make an interactive session on the topic ethics of research in childhood cancers. And I would like to say that I'm really happy to make it today with you, because tomorrow I will make the same presentation and the same interactive session with another parents group in Valencia, and I think it will be very interesting to have and to compare, to bring together your inputs and with those of European parents. Our challenge in the next 20 minutes is to address three very hot ethical topics together and to deliberate on these topics in order to save us some time left for a more open discussion. Very briefly, what's the ethics about within the ENCCA project? ENCCA stands for European Network for Cancer Research in Children and Adolescents. It's an important European project. And within this project, there is one work package dedicated to ethics. Two keywords about our work within this work package. The first keyword is about competent literature review, but that's not the most important. I think the most important is the second keyword. It is about consultation. Consultation with clinicians and consultation with parents' representatives. And here I have to acknowledge the very active role of the European Parents Group I mentioned earlier, namely the International Confederation of Childhood Cancer Parents Organization, the ICPU. So my role in this work package is merely to give an accurate picture on the ethical debates and also to facilitate this consultation and deliberation. And I'd like to mention we made two important consultations so far on confidentiality in biobanks, and actually the young people advocacy group of the Birmingham Children's Hospital did participate in this consultation, and they made a very good job in this consultation. We also organized another consultation about clinical trials. And your role as a professional and as a parents and patients representative consists in expressing your needs and concerns, and also in the light of your personal and clinical experience to challenge the generalizations of ethics about what it is right to do or not to do with children with cancer. Okay? It's very important to challenge generalization, I think. Without such a challenge, ethics can turn out to be pedantic and empty or useless. We can think about this story of a scholar who pompously addresses a large audience and says there is only one aspirated S in English in the word sugar. And luckily enough, in this audience, someone is critical enough to ask ironically, "Are you sure?" So I hope I will not play the role of the pedantic scholar today, but I do hope that you will accept to take the role of the critical audience, and for that reason you have handouts on your table, so you can each of you can take this handout, okay? And it will allow you to give your opinion and your views on the three topics we will address. You can take the first page apart so you know where to get return on the results of our deliberations today. And I'd like to address with you few issues on which we don't have any precise or clear idea so far within the ethics work package of ENCCA, namely about why and how to better involve parents and patients representatives in research. The second topic is quite more sensitive. It's about what to do with samples and data from deceased patients, from patients who have died. And the third topic is about, so can we speak about potentially harmful parental choices and what to do in such a situation. I will give you some insight on our results so far within ENCCA, but the main point is that these results from our consultations are not conclusive on this topic. And that's why you can accrue your inputs in the handout, which is available on the tables. Okay? So, for each topic, I will use an introductory case, a fictional case. For the first case, we have the situation of a parent's representative in a corridor in some hospital, and the parent's representative asks a doctor, what's the topic of the meeting inside? And the doctor answers that it's to design the next trial, to know which treatment is best. And then, immediately, the discussion begins between professional experts. The biostatistician says, yes, to know which treatment is best, you should enroll as much patients as possible, and the bioethicist answers, yes, maybe you should, but you can't, and the number of children participated in the trial should be as small as possible. And this morning you spoke about expert parents, and in this situation I wanted to outline the fact that sometimes expert parents are maybe outside the room where professionals are discussing about designing a new trial. And here the parent's representative is quite upset and says, excuse me, but who are you? Why are you in while I'm standing out? Basically this issue, this situation raised the issue, so how to let the patient's representative in inside the meeting room to discuss about the design of the next trial. We know from literature reviews we made within ENCCA that the level of protection of children within clinical trials is high, okay, based on two principles. The first principle is no bad deal trial in children. It is unethical to involve the child in a clinical trial unless it is in this child's best interest. Okay? The second principle is no package deal trial in children. It means that for each clinical investigation or several experimental interventions or research interventions, and you cannot make trade-off between the risk of one intervention and the benefits of another intervention. Each intervention must have its own ethical justification. From ENCCA consultation, we know that parents' representatives claim for an equal partnership in research, and they also claim to stand in review or ethics committee, in review boards of or ethics committee, for instance, in biobanks. And professionals are much more undecided. It's not that they are against patients and parents' representative involvement in research, but they feel that to increase the number of payers will increase the number of the obstacles on research. And on the other hand, they acknowledge that it can increase the acceptability of research, fasten the authorization process, and maybe improve recruitment. So now I'd like to ask a list of questions to you. First of all, I would like to know if, in your view, the involvement of parents and patients' representatives in research is a major topic of interest. Yes or no? It's very important for us to know, is it a major topic of interest? Is it a hard topic we should reflect on it? Then another question is about, so what's the effect of involving parents' representatives in research? Would it improve the patient's protection, in your view? What's your opinion about this question? Indeed, the level of protection of children in research is high, and do you think that it would be improved by involving parents and patients' representatives in research? And in this case, I would be interested in if you could add in comment why, so if you are dissatisfied with the current review procedures of clinical research. And the third question is about, yes, let's involve parents and patients much more earlier in the research, and which would be the most important desired outcome for you? Would it be about to facilitate research, so we can measure the effectiveness of parents and patients' involvement, because it makes authorization faster, it improves the recruitment? Would the most important outcome for you to be to modify the research orientations? And maybe you could add in comments whether you are dissatisfied with current orientations of cancer research in children, or a better desired outcome would be for you to improve the subject satisfaction of families and children participating in research. Are you okay with the procedure? Maybe a handout? Okay, thank you. Another topic I would like to address with you, and I would like you take some time to deliberate on it, is how to deal with samples and data from patients who have died. Here we have the situation where a researcher is talking with two lawyers. The researcher explained that a 12-year-old girl died from a hearing sarcoma, and parents consented to the use of her tissue and blood for research when she was alive. And the researcher would like to know, so can we still use the samples of this child in research? The first lawyer was liberal. He has a very broad interpretation of the need for consent and answer yes, since parents did not withdraw their consent, you can use it in research. His colleague has a much more narrow interpretation of the need for consent, and he says no, we cannot use it in research. If they did not consent to posthumous use, you have to contact them and to get a new consent. So the researcher is ambivalent. So I'm left the alternative of presuming consent or of harming these parents. And the two lawyers ask, yes, but why didn't you ask consent to posthumous research uses of samples and blood from start? And here the researcher is astonished. I can believe you suggested we were talking about patients with cancer. From the literature reviews, we know that this topic is maybe, that the literature of this topic is quite rare. It's quite difficult to find it. Enough literature on this topic, and the point is that maybe it's not the elephant in the room of genetic research in children and adolescents, but at least it is an emerging issue, and this issue will become more and more important in the next years to come. We also know that parental consent is one option, and there are at least two other alternatives to parental consent in this case. The first alternative consists in authorizing an ethics committee to waive the need for consent under strict conditions. Another alternative is to conceive, is to donate the samples and the blood to science. For instance, a review article investigates the possibility to use health data contained in health records after the death of a patient based on donation of these data. And the title of the review is "Don't Take Your Health Data to Heaven, Donate It to Science." From ENCCA consultation, we know that representatives are supportive of research by banking, and we also know that they highly value consent, but they don't want to be recontacted each time for each research project using the samples and the data of the child. And for professionals, we know that not to use the samples and the data from patients who have died is not an option. If you want to learn about very rare tumors and subgroups, you have to find a way, an appropriate way to use these samples and data in research. So, my first question to you would be, does your institution or your association have a policy or a statement about this issue? And if yes, could you briefly describe which is the policy or the public position of your association on this topic? Then I would like to know if, in your opinion, an ethics committee should be authorized to waive the need for consent under strict condition, and provided that the confidentiality of the child and of the family are efficiently protected. The third question concerns the idea of donation. If this idea of donating samples and data of a child after the child died, is this idea something acceptable in your view? And then we have to go a little bit inside the question of making it practicable. Namely, what's the appropriate model for this idea of donation? Is it the appropriate model? Is it organ donation, which means to contact the parents, the bereaved parents, nearly the death of the child, to have the consent to keep the samples and data for research? Or another model is the model of concern registration, meaning that until the parents withdraw their consent to use the samples and the data, that can be used in research. So, the last case, the last discussion will be about what to do in case of potentially harmful parental choices, if any. Here we have a discussion between a doctor, a patient, and a mother. The doctor speaks with the patients who already participated in clinical trials, and you received an upfront standard chemotherapy and then an additional experimental therapy. As you already know it, last scans have confirmed that the tumor is still present. We also discussed about proceeding with an improved experimental therapy. And then the 15 years old patient answers, no, I don't want the drug. Last 3 months have been very hard, and what for? The tumor is still there, and I want you to allow me to die on my own terms. And then the mother interrupts and states emphatically to her son, this is my decision to make the cures into the doctor. If you don't want to treat him, I will take him to a doctor who will. So, in such a situation, we know from literature review that the children and adolescents have rights on their own, and especially the right to participate in decision making. And they also have the right to refuse or to object to research participation. On the other hand, parents must be respected as parents. They are not the child best, and they are the natural surrogate of the child. And thirdly, the clinician is always the agent of the best interest of the child. It means that in case of intrafamilial disagreement, as in the previous case, the clinician can advocate for his patient, or in the best interest of his patient. From ENCCA consultation, we know that we do know nothing about such a situation. I mean, that representatives are reluctant to take a position about parenting styles and about the idea of potentially harmful parental choice. From the consultation we had in an open comments, how do I know how individual parents decide? It's individual, it depends on the child. For this reason, the discussion of this last case will be much more open in its form. The first question is, do you think that this issue of potentially harmful parental choices is an important issue or concern, or do you think it is marginal and it is easily solved in the everyday practice? My second question is, would you say that in this case the attitude of Michael's mother is harmful? A very interesting article here describes the mindset of a mother regarding early phase clinical trials. And after many years of inefficient treatment, she had lost all her landmarks and was ready to accept any proposition, even those she would have considered unacceptable earlier. But if we agreed, or not, but if the idea is acceptable that some parental choices can be harmful, the point is who should judge this? The point is that the clinician already offered the inclusion in the clinical trial to Michael. It means that in the view of the clinician, to participate in this research was compatible with Michael's best interest. So it's quite tricky to then to judge after that the position of his mother is harmful. That's why my last question to you is very open question, and it's an open discussion. Which approach would you recommend in this case? So, please, on the last page of your handout, it is very important if you can indicate or answer about your question. And I thank you very much, and I'm ready to answer your question.